Hi, I'm Dr. Beluga and welcome to PhiTube.com. In this video we're going to discuss the drug Lamictal, which is otherwise known as Lamotrigine. This is an anti-epileptic or anti-seizure drug that is usually treat the following seizures. Number one is partial seizures, which usually involve electrical discharge in a particular focus or one side of the brain. These seizures can become generalized, whereafter they go to both sides of the brain and can spread to both hemispheres. Lamictal also treats tonic-clonic seizures, which originate in both hemispheres of the brain. A tonic-clonic seizure is known as a stiff phase, and then a twitching phase thereafter, with or without confusion afterwards. Lamictal can also be used as an add-on therapy for absence seizures, a seizure condition where patients have staring spells. Lamictal is also used for generalized seizures of Lennox Gastaut Syndrome, a condition where patients start to have seizures before the age of 4 years old, coupled with intellectual disability and myoclonic seizures. Lamictal is also used for myoclonic seizures where patients have muscle jerking. You may take this medication without regard to meals. The regular tablets should not be chewed as a bitter taste may result. The chewable, dispersible tablets may be swallowed whole, chewed, or dispersed in water or diluted in fruit juice. To disperse, add the tablets to about 1 teaspoon of water or diluted fruit juice. It takes about 1 minute to completely dissolve the medication. It is important to swirl the solution to take the entire amount of liquid. Infants who are exposed to Lamictal have a prevalence rate of 8.9 per thousand of oral cleft problems. Basically what this means is that 8.9 out of 1,000 women treated with Lamictal have a 24 times higher risk of having oral cleft problems. Now, an oral cleft problem is either cleft lip or cleft palate. The manufacturer of Lamictal, the brand name version of Lamotrigine, has stated that Lamictal should not be used in pregnancy. He also states that it should only be used if the potential benefit justifies the potential risk to the fetus. You should speak with your physician about being on Lamictal. The baby will get some Lamictal through the milk. The effects are unknown. For this reason, breastfeeding while taking Lamictal is not recommended. All women who are capable of becoming pregnant should take at least 0.4 milligrams of the vitamin called folic acid every day because it helps to prevent the birth defect known as spina bifida. Women at higher risk, such as those with a history of this kind of defect in previous pregnancy, should take about 4,000 micrograms or 4 milligrams daily, beginning from the time that they become pregnant, or even before that. In general, the risk of defects is higher for women who take more than one type of seizure medicine and for women with a family history of birth defects. You should call the neurology clinic or your primary care provider immediately if the following side effects occur. Rash can be serious enough to require hospitalization. The incidence of rash can be decreased by starting at very small doses and then increasing Lamictal very slowly. Fever and swollen glands are also side effects that you should call your neurologist about. The most common side effects when the medication is first started or the dose is increased are dizziness, drowsiness, the inability to sleep, headache, nausea, tremor, and balance problems. When the dose is increased, the effects of the medication can cause balance problems, visual problems, lethargy, sleepiness, headaches, tics, and insomnia. Once again, serious side effects that should be watched about from Lamictal is an idiosyncratic rash called Stevens-Johnson syndrome. Please notify your physician immediately if you develop any rash and a fever. Some effects should get better with time as the body adjusts the medication. You should inform your neurologist and/or PCP immediately if you have any side effects. Some blood tests may be required to properly monitor Lamictal. A level is usually seen therapeutic if the level is from 3 micrograms per ml to 14 micrograms per ml. Tests monitor the proper level of medication. However, it is important to keep the appointments with your doctor and to know that your physician is treating you and not the number. Drug interactions that Lamictal has are sertraline, otherwise known as Zoloft, which can result in increased concentrations of Lamictal. Oral contraceptives can lower Lamictal concentrations. Tegretol, or carbamazepine, can cause Lamictal to have toxic concentrations. And valproic acid, otherwise known as Depakote, can increase the chance of having a severe rash and increase the level of Lamictal in the blood. Tylenol can decrease the effectiveness of Lamictal. Phenytoin is known to decrease the level of Lamictal in the blood, as well as increase the side effects of dizziness, vision problems such as blurred vision, and balance problems. These symptoms can be relieved by spacing Lamictal and carbamazepine or phenytoin by at least 1 hour. It is important to remember that all anti-epileptic drugs are thought to increase the risk of suicidal ideation. You should please inform your physician of any signs of depression, such as feeling guilty, insomnia, decreased overall energy, apathy, and an overall agitated state.